Here we will learn the anatomy of bone articulations, also known as joints, which allow for movement and provide stability. To begin, start a table. List the two major classification systems of joints as follows. The functional classification, which is determined by the degree of movement permitted by the joint. The functional classification types are synarthrosis, amphiarthrosis, and diarthrosis. Structural classification, which is determined by the joint's connective tissue type and whether there is a cavity within the joint. The structural classification types are fibrous, cartilaginous, and synovial. Begin with the functional classification. Draw a horizontal line. Label one end as immovable, highly stable. Label the other end as freely movable, unstable. We can appreciate from this diagram that an inverse relationship exists between joint mobility and stability. On the immovable end, write synarthrosis. Synarthrosis joints are immovable and highly stable. Try to wiggle one of your teeth with your tongue or fingers. You can't because the joints between your teeth and their sockets are synarthrosis. On the freely movable end, write diarthrosis. Diarthrosis joints are freely movable and very unstable. Wiggle your fingers and note how easy it is to move the bones of the fingers or phalanges. The phalanges relate via diarthrosis joints. Next, along the center of the line, write amphiarthrosis. Amphiarthrosis joints allow for moderate mobility and stability. To demonstrate this, bend your vertebral column, which contains amphiarthrosis joints. Clearly, you can move your spine more freely than your teeth, but less freely than your phalanges. Now let's address the structural classification of joints. As we do so, we will review the functional classification system to understand how the two systems interrelate. Show that based on the structural classification, joints categorize as fibrous, cartilaginous, or synovial. First, let's draw the three different types of fibrous joints: syndesmosis, suture, and gomphosis. Start with a syndesmosis fibrous joint. Draw two long bones, for example the radius and ulna. Then connect them with fibrous connective tissue, which is the fibrous joint. Structurally, this is a syndesmosis joint because bones are joined by dense, regular connective tissue fibers, and functionally, it is an amphiarthrosis joint as it is only slightly mobile. Next, show a suture joint connecting skull bones. Structurally, this is a suture joint because it is comprised of skull bones connected via dense, regular connective tissues, and functionally, because it is immobile in the adult, it is a synarthrosis joint. Now draw a tooth with its roots adhering to the mandible. Label the fibrous joint between the two as gomphosis. Structurally, this is a gomphosis joint because periodontal membranes hold the teeth to the jaw, and functionally, it is a synarthrosis joint. Next, let's show the two subtypes of cartilaginous joints, symphysis and synchondrosis. First, draw the bodies of two vertebrae. Then draw an intervertebral disc between them. Structurally, this is a symphysis joint because of the fibrocartilage pad, and functionally, it is a amphiarthrosis or slightly mobile joint. Now draw the junction of costal cartilage and a rib. Structurally, it is classified as a synchondrosis joint because it comprises hyaline cartilage, and functionally, it is a synarthrosis joint. Lastly, let's show a prototypical example of a synovial joint, of which there are many structural subtypes. All synovial joints are functionally classified as diarthrosis because of their high degree of mobility. To show the universal characteristics of synovial joints, draw two long bones with a space, a cavity between them. Label this space as the joint or articular cavity. Next, draw articular hyaline cartilage covering the articulating ends of the bones. This cartilage provides a smooth surface for movement, absorbs shock at the joint, and protects the underlying bone surface. Now draw the synovial membrane from the articular cartilage edges of one bone to the other. The synovial membrane, which comprises areolar connective tissue, does not cover the articular cartilage, but rather encloses the joint cavity. It secretes synovial fluid, which lubricates the joint, nourishes the cartilage, and absorbs shock to the joint. Denote that synovitis is a painful inflammatory condition of the synovial membrane that commonly occurs in rheumatologic conditions such as rheumatoid arthritis, lupus, gout, or simply by overuse injury. Now draw the fibrous layer, which comprises dense irregular connective tissue called ligaments. The synovial membrane and the fibrous layer together create the articular capsule. Lastly, show the extrinsic, also known as extracapsular, ligaments which lie outside of the articulate capsule to provide additional stability. Finally, let's list the following examples of freely movable synovial joints. Gliding joints occur where flat surfaces meet to allow sliding and twisting. The wrist bones, or carpals, are joined by gliding joints. Pivot joints form where a round projection fits inside a ring to allow rotation. The first and second cervical vertebrae articulate via a pivot joint. Condylar joints occur where one bone fits into an oval-shaped depression in another bone, such as where the radius cradles the carpals. Saddle joints occur when the saddle-shaped region of one bone articulates with a depression on another bone, such as where the carpal and first metacarpal, the thumb, meet. Ball and socket joints form where a ball-like process fits inside a cup-like depression, which allows maximum freedom of motion, such as between the head of the humerus and the glenoid cavity of the scapula. This concludes our diagram.